Hey everyone, my name is Dr. Adrian Huang and I'm an orthopedic surgeon here at the University of British Columbia. Welcome to the first ever Scrubbedout videocast, also available as a podcast. What a better way to do this, especially during application season for medical students into residency programs, than to talk about some ways that you can maximize your residency application. Now, this is going to be a medical lifestyle magazine for healthcare professionals. So make sure you subscribe and check out all of our social media. I can't think of a better person to bring us through with our first episode than this gentleman sitting beside me. He is an orthopedic trauma surgeon at the University of British Columbia, and he's based out of Vancouver General Hospital. He's a clinical professor at our institution, and he has been the program director for our orthopedic surgery residency program for the past 13 years. So please welcome Dr. Henry Broekhuyse. Thank you very much for joining us and doing this video with us.
And thank you for having me here today, Adrian.
So one of the biggest things I think we want to talk about is the residency program at UBC. So why don't you go ahead and maybe tell us some of the strengths and what the UBC program can offer prospective applicants.
Great. Well, the first thing people always ask me is why come to UBC and why come to Vancouver? And what is it that we can offer that's better than what any other program can offer? What are our advantages? So if you don't mind, I'll start talking about a few of those.
Please, go ahead. Absolutely.
Okay. So right off the bat, I have to say the presence of people like Adrian. Our faculty is one of our two greatest strengths, because we've got faculty that are absolute experts in their field, and they practice their subspecialty and only their subspecialty. So they have a very wide breadth and depth of knowledge and experience in what they do, and also then what they teach to the residents. And all of them are all certainly nationally, if not internationally, recognized for their expertise. So the residents here get to benefit from an incredible amount of faculty expertise on their rotations. The next group of people that I really have to acknowledge as being the biggest strength of our program are the residents themselves, who come from a wide variety of backgrounds, have a wide variety of interests, and are supremely a very nice group of people to work with that work very hard, are extremely collegial, and I think that in a residency program is very, very important, because the residents themselves are often their own biggest source of support, and having a group of residents that get along with each other and support each other is a really important thing to have. I especially get asked that, particularly in the context of our program, because our program is pretty large, and a lot of residents feel that if they're joining a very large residency program, that it becomes very large, it becomes very informal, they won't know who the faculty are, they won't know who their fellow residents are, and that isn't the case in our program. Even though right now, this year, we've got 28 residents in our program. Every one of them knows each other. The residents within each year know each other very, very well, and are very good systems of support for each other. And certainly all the faculty, like you, know all of the residents who are in the program as well, and get an opportunity to meet them on multiple occasions, both on rotations and in teaching sessions, and often in social circumstances as well.
I have to definitely agree with that. So as you said, we have subspecialty surgeons in all the different programs, and each one leads their respective teaching endeavors, so which is awesome. Just to add to that also, the research here is also very strong. We had our research day here not long ago, and I was really impressed with the quality of the publications and the projects that the residents had going on. Right,
and I didn't mention that, but certainly all the faculty are well known, as I said, both nationally and internationally for their expertise, but also many of them have very large and important research contributions that they have made and continue to make. And that is another benefit to the residents who are in our program, is to be able to participate in some of that research, and often use that to carry on through their career as the start for their own research programs, their own research ideas.
So one of the questions that I get oftentimes is, how important is research, and more specific orthopedic research? Because the problem for many medical students is they don't know they want to do orthopedics until third and fourth year, and by that time they've already completed a lot of research in other specialties.
Right, and that's right at the top of the list of questions I often get asked as well, as how important is research, and if I haven't done any, should I be doing some now? My answer to that question is that yes, clearly we do, and every other program does look at medical students' research aptitude and interest. It's great if students have already done some research in orthopedic surgery, but it's not essential that it be research or in orthopedic surgery for two reasons. Because there's two other things I look at just beyond the issue of whether somebody's done some orthopedic research. One is if they've done research of any kind. There is a lot of evidence to suggest that students, or anyone for that matter, who has a demonstrated record of aptitude or interest in any field of research before they enter residency are very likely to carry that on through residency, and actually are even very likely to carry that on past residency. So that's the first thing. Is it doesn't have to be orthopedic research. If you've demonstrated an interest in doing research in any other field, I will count that fairly highly as well. And the other thing is that some people don't have a particular interest in research, but demonstrate that they've got an interest in aptitude or just a drive to do something else, to have some other field of accomplishment. And that's what I will look for, is that, okay, if a student may not have spent a lot of time doing research, but what did they do besides that? There are likely other areas of endeavor that they've accomplished themselves in, and I'm just as interested in hearing about that as I am hearing whether they do research.
And this is interesting because this is a wonderful year for applicants. Because we are interviewing everybody, it's a great chance for the applicants this year to build their narrative to something that kind of suits their strengths. And again, like you said, it doesn't have to necessarily be research, as long as you show commitment into some endeavor. Is that kind of correct to say?
Yeah, that's exactly right. And then the other common question I get is, well, what else are we looking for? And the other thing we're all looking for, all program directors and orthopedics for that matter across the country, we're all looking for individuals who show evidence that they can work as a team and that they have the ability to lead a team. Because as a practicing orthopedic surgeon, you are going to always be working with a large group of people, whether that's on the ward, in the operating rooms, in the clinic. It's never just you running your practice. It's you very dependent on getting results that depend on the interaction and the contribution of a lot of other people. So you have to show that I'm interested in seeing that you've been able to demonstrate some way that you've been able to work well in a team environment, and a team in the broad sense, not necessarily a sports team, but any other team that's worked together to accomplish a goal. And lastly, that I'm also very interested in seeing whether or not students have had some opportunity to lead a team, because as an orthopedic surgeon, you will at some point in your career start to be called on a rather frequent basis to be the leader of a team of some sort. And so those are two factors that we count very highly in our selection process as well.
And so, in terms of showing us and telling us all these things, is the best way to do it in terms of building a narrative for your interview, or is it something along the lines of writing in a personal statement? How much does that weigh into your decision?
Both. We read both the personal statements, and that's a great introduction to your interview day, because most of your interviewers will have read that personal statement and will often use that as trigger ideas for coming up with questions. But certainly think ahead, and virtually all students know this in advance, think ahead of the typical questions you'd be asked. And yes, have a narrative prepared for those common questions, which go beyond why Vancouver and why orthopedic surgery.
No, absolutely. So in terms of the personal statement, one of the things I always get asked is, how long should it be? How detailed should it be? I think from my personal perspective, when I was writing my personal statement, it was one page, because my advice was, well, orthopedic surgeons don't necessarily want to read too much, but they want it packed with information.
Yeah.
Is that something you would agree with?
That's correct. One page is sufficient, which means you have to give it some thought, because you want to be efficient with your words, not one page. And I also recognize that I'm not the only program who's looking for a personal statement, and we're all looking for a personal statement that somehow singles out our program as one that you're particularly interested in. And so I recognize you can't write a dozen different personal statements. That's just not reasonable.
Tell me a little bit about the fit in terms of the interview process this year, again, because we're interviewing everyone because of COVID, but how important is that fit in terms of finding somebody that you'll gel with, I guess for the next 5 years?
Right. As I was saying before, that's the first and foremost thing we're actually looking for in the interview process. Is we're looking for people that not only we'll be happy to work with for 5 years, but also people that we recognize will become our colleagues, whether in the city, in the province, or elsewhere in Canada, that we would look forward to working with for a lifetime. And so we really are looking for future colleagues as much as we're looking for people who've got the interest in aptitude for orthopedic surgery.
Yeah, and it's interesting as well because on the flip side of that, the students also have to come and see what we're about and see if,
Correct.
We fit what their expectations are as well. So that's again why the interview dates are really important. So if you're interested in the program, please make sure you apply and we'd love to meet you.
So if we carry on our previous theme of why should somebody come here to do orthopedic surgery, as we said, our faculty and our residents are one of our really big strengths. But all of the rotations that our residents do are all subspecialty based. We don't have any general orthopedic rotations in our training program. So every rotation a resident is on, they're learning from experts and they're just doing clinical work in that particular field for the duration of that rotation, be it 1 block or 3 blocks. And not only do we have some very, very strong subspecialty rotations, but we also have one very strong community rotation based out of Prince George Hospital, which I think our residents would acknowledge is probably their most favorite rotation of the entire program. Not only for the opportunity to work in a community hospital setting, but also the surgeons that are there are very engaged in resident education and give the residents who are there a lot of opportunity for practicing their surgical skills, which is admittedly sometimes difficult in a large teaching hospital in downtown Vancouver. So we spent a lot of time talking about the clinical experiences that residents get here, but we have a very, very strong academic program of formal teaching as well. And I'll spend a few minutes just to review what we do there. We have a very well organized academic half-day session which runs every Thursday afternoon through the entire academic year. The Thursday afternoon teaching sessions during the summer months of July and August are dedicated totally to doing anatomy dissections, which I'm happy to say are supervised by Dr. Wang, and are very popular, and all residents in all years attend those and hence get the opportunity to do that 5 times over the course of their training. Every single rotation has early morning teaching rounds that run on most weekdays. Most of those are case-based, and so it provides an opportunity for residents to talk to the experts on those rotations in a more informal setting and actually discuss cases on a case-based basis centered either on recent cases that they've treated on that rotation or on broader concepts and broader topics because, again, they're in a setting where they're working with the experts in that field. And then finally, we've got 2 rather unique teaching programs in this program that don't have exact equivalents in other programs, one of which is our boot camp, which runs for one entire block of 4 weeks. It is typically held in block 3 of the PGY year. And we cover everything there from doing the skills and the lectures from the basic AO course to doing a bit of anatomy dissections, learning from the residents over the course of a week on topics such as top 10 consults I might expect in the emergency department. And then finally, we've got a very well organized and run crash course, which is run by our Surgical Foundation program and takes place over the month of September, October in block 4, and is again a month of just simply teaching on topics that are of importance to all surgical residents and cover the gamut from acid-base balance to running through the entire ATLS course, which is a bonus, and covering other diverse topics like residents as teachers, which I get involved in.
Both those are programs the residents really like, so I think it's been a very valuable experience for them.
Yeah, and it's a very unique experience because we don't expect the residents to cover much call during either of those 2 months. They basically do call a couple of days on weekends for both of those 2 months, which allows them a lot of time for thinking, a lot of time for being prepared for the next day's activities, and there's just a lot of hands-on activities that occur during both of those months. It's not a matter of sitting down and listening to lectures for 8 hours a day for 4 weeks straight.
Unfortunately, now with the COVID experience happening, normally the process would be that a prospective applicant would come and do an elective with us and see what the program is about. I think you've given a really good rundown, but in the absence of being able or being allowed to do that, what are some things that an applicant can do to find out more information about the program, or get maybe a more hands-on experience, and also to optimize their application into our residency program?
Right, Adrian. So as you pointed out, the problem this year is that students have really very limited ability to find out about programs if they're not within that particular site. And we similarly also have great difficulty in learning who they are, because typically we'd be able to spend anywhere from 2 to 4 weeks with many of the people that we were interested in bringing into our program because they were doing an elective with us. So we have to come up with alternatives to that. With regard to students finding out more about our program, well, you're looking at one of them. This is one of the ways we want to reach out, but we're going to go beyond this and plan over the coming months to hold several information sessions where people like myself and you and other faculty be invited, and also, very importantly, the residents will be invited to just have an hour or two long session where students can join in by video and listen to us talk briefly about our interests and what the program is like, but more importantly, to give all the students an opportunity to actually talk to us and to talk to the residents, which is something that they would normally be able to do if they were here in elective, but now cannot. As far as things that students can do to apply or improve their chances of getting into our program, because we would like to have as many people as possible interested. Basically, you're going to end up doing much the same as you did in years past, but it will all be at your own home program. And so we're going to be having to count on what your local faculty say about you. And I encourage everybody to do as many electives as they can with different faculty members within their own program. And we and some other programs are happy to see reference letters from as many different faculty as you can, who can write you a strong positive reference.
In terms of reference letters, do you think that this year references are more important because of COVID, or will they hold the same weight?
They will hold the same weight. This is a question I get asked as well from students as well. What do I do now that I can only get a limited number of faculty to write me a letter, and they're only from local faculty? And my answer to that is, don't worry about it. Orthopedics is a fairly small community in Canada, and all of us have a pretty good idea and know, if not very well, a lot of the other faculty across the country. And so in many respects, getting a reference letter written by one of your local faculty is just as good as if you had actually been here and had one written by one of our own faculty locally. We will also be interviewing everybody who applies to our program because in an environment where we can't pre-select individuals, we want to be able to give everybody the maximum possible opportunity to be able to have a chance at not only participating in our interview process, but in us being able to interview and talk to as many potential interested medical students as we possibly can.
So that's very awesome, and that's a very good point. So this year, if you're interested, definitely send in an application, because you'll at least get a chance to talk to us and kind of let you personally shine through.
Okay, Adrian, so now tell us, how can people learn a bit more about our program?
So if you're interested in applying, and I really hope that you are, over the next 3 or 4 months, we are going to have several online Zoom call question and answer periods. We will be releasing the dates soon, and I'll let you guys know as soon as I find out what those days are. In the meantime, if you're interested, please keep in contact, and you can find us on our social media platforms, which I'll list down in the description. I encourage you to apply, because in light of our unusual year, will be one of the best ways, if not the best way, for you to find out what we're about and for us to meet each other. So Dr. Broekhuyse, thanks so much for being here. Before you go, though, I just wanted to rehash the top 3 tips that we have for orthopedic surgery applicants. So the first one is apply, because again, this year is a little bit unusual, so we will be interviewing everybody. And that gives us a great chance to get to know each other.
Correct.
Step 2 is, it's not so much the research that matters, it's the point about showing commitment and leadership in any endeavor.
Correct.
And finally, because you're unable to come and do electives with us this year, make sure you do as many orthopedic electives as you can in your home hospital and get your faculty there to write us reference letters.
Right, and we recognize that you can't do all your electives in orthopedic surgery, and we're also interested in reading reference letters, really from any rotation you're on, but certainly from any surgical discipline that you do a rotation on. I value those reference letters almost as much as I do reading the ones from our orthopedic surgery colleagues. Thanks, Adrian. I hope we will see many of you during one of our information sessions over the coming months, and we'll definitely see you during our interviews in March.
See you there.